If a patient with headache walks into your OSCE and you don't do this neurological exam properly, you don't lose marks, you lose the station. In this video, I'll show you how real doctors examine headache patients with clear medical English, OSCE-ready structure, and consultation-level language. Section 1. Role play.
Hello, my name is Dr. Lee. I understand you've been experiencing headaches. Before we talk about treatment, I'd like to carry out a focused neurological examination.
Okay, what does that involve?
I'll be checking how your nerves, muscles, and coordination are working. The examination shouldn't be painful, but some parts may feel slightly uncomfortable. If you feel pain, dizziness, or nausea at any point, please let me know. Is that all right?
Yes, that's fine.
First, I'm just observing how you're sitting and speaking, and whether you appear alert and comfortable.
All right.
I'm going to examine your eye movements now. Please keep your head still and follow my finger with your eyes.
Like this?
Yes, exactly. Please tell me if you notice any double vision or feel dizzy. Now I'll check your pupils. You'll see a light. Just look straight ahead. I'm going to lightly touch different areas of your face. Please tell me if the sensation feels the same on both sides.
Yes, it feels the same.
Could you stretch your arms out in front of you with your palms facing upwards and close your eyes?
Okay.
I'm checking for any weakness or involuntary movement. Now I'd like to assess your coordination. Please touch your finger to your nose and then to my finger.
All right.
Good. Take your time. I'm going to lightly touch your arms. Please say yes whenever you feel it. When you're ready, could you stand up and walk a few steps for me? This helps me assess your balance.
Does everything seem normal?
So far, your neurological examination appears normal, and I haven't identified any focal neurological signs. That's reassuring. To summarize, your neurological examination is unremarkable. The next step is to combine these findings with your history. If necessary, we may consider further investigations, but we'll discuss that together.
Section 2. Killer phrases. All examiner-friendly. All consultation-ready. 1. I'd like to carry out a focused neurological examination. 2. Please let me know if you feel pain, dizziness, or nausea. 3. I'm checking for any weakness or involuntary movement. 4. The next step is to combine these findings with your history. 5. Please keep your head still and follow my finger with your eyes. 6. Tell me if the sensation feels the same on both sides. 7. This helps me assess your coordination. 8. I haven't identified any focal neurological signs. 9. Your neurological examination is unremarkable. Section 3. Practice. Pure medical English. Exercise 1. MCQ. Choose the most professional option a doctor would use during a neurological exam. Question 1. The examination shouldn't be painful, but it may feel slightly A. Weird. B. Uncomfortable. C. Hard. Think. Correct answer, B. Uncomfortable. Question 2. Please let me know if you feel pain, dizziness, or A. Sickness. B. Stress. C. Nausea. Correct answer, C. Nausea. Question 3. I'm just blank how you're sitting and speaking. A. Watching. B. Checking. C. Observing. Correct answer, C. Observing. Question 4. Please keep your head still and my finger with your eyes. A. Look at. B. Watch. C. Follow. Correct answer, C. Follow. Question 5. Tell me if the sensation feels the same on A. Parts. B. Sides. C. Directions. Correct answer, B. Sides. Question 6. I'm checking for any weakness or movement. A. Random. B. Involuntary. C. Unusual. Correct answer, B. Involuntary. Question 7. Your neurological examination is A. Normal, B. Fine, C. Unremarkable. Correct answer, C. Unremarkable. Exercise 2. Complete the doctor's sentence. 1. I'd like to carry out a focused neurological examination to 2. Please let me know if you feel pain, dizziness, or 3. I'm checking for any weakness, or 4. The next step is to combine these findings with your Exercise 3. Comment challenge. Write in the comments 1 sentence asking for consent, 1 sentence reassuring the patient, 1 sentence explaining next steps. And that's it. Waiting for your answers. Subscribe, practice with us, and turn your medical knowledge into Medical English Pro.